Doctors of Reddit, what is the weirdest thing a patient wouldn't admit? I admitted a guy for chest pain. As part of the workup, I did a urine drug screen which came back positive for C. After the rest of his cardiac workup was negative, I said to him, "Good news, you didn't have a heart attack. It's likely that your chest pain was caused by C." His answer, "I didn't use C. I was at a party and people had some lines of C out on a table. As I was walking by, an oscillating fan blew the C into my face, which is why my urine was positive. MMMHMM. Got it? Yeah, 'cause parties with C on the table frequently have fans near the coke." Obligatory, not a doctor. I'm a nurse. We had a patient come into the operating room for brain surgery. Probably a mid-50s guy with a nice head of light brown hair. Before a patient comes into the actual OR, we ask them a series of questions, including whether they have any implants, jewelry, non-hospital clothes on, etc. Guy says no to all the questions. After the patient gets put to sleep, the surgeon grabbed his hair to start shaving it off. Because brain surgery, and all his hair peeled off because he was wearing a wig and didn't tell us. We almost shaved his hairpiece because he wouldn't admit to anyone he wore it. Nurse here. Had parents bring their 3-year-old son to the emergency department for 1 month of abdominal pain that kept getting worse. I ask all the routine questions for this complaint. Lots of questions about his poop. Is it bloody? Diarrhea? Mucus? When was his last bowel movement? Any changes in the stool? They deny any other concerning symptoms but abdominal pain. We do blood work, ultrasound, x-ray. Everything comes back completely normal but the kid is intermittently screaming in pain, curled in a ball. Over the next 5 hours I continue to repeat the same questions. I asked repeatedly if there was anything else going on that they could think of. Nope. The kid just doesn't seem well but we have no reason to keep him. We decide to watch him a little longer, let him eat. The kid eats a bunch. A PBJ, apple juice, crackers, popsicle. No pain, so we decide to send them home. I bring in the discharge paperwork and I'm about to start going over instructions and the dad goes, for the past 3 months he's had a lot of worms in his poop. Worms. Freaking worms. You spent 6+ hours denying worms. I literally just turned around and walked out of the room without saying a word. I was laughing almost to the point of tears. Could not wait to tell my resident. Deworming medications, a crap load of wasted time, and they were on their way. Seems like dad was embarrassed to have known and ignored it, so he wanted the hospital to find out on their own so that he could act surprised and save face. I'm a pediatric dentist, so maybe not the type of doctor you were looking for, but this one throws me for a loop every time, so I'll share it. When I sedate kids they have to be NPO for 8 hours before, so I always ask if they had anything to eat or drink in the morning. Parents never want to admit their kid ate or drank, even when I remind them it's very important because if they vomit and aspirate they could die. Often they try to minimize it and say it was just a few bites, but one kid walked in eating a bag of Cheetos at reception and then the parent insisted to me that they hadn't eaten. Yeah, I'm 100% not sedating your child today. Obligatory, not a doctor. Used to work PR and marketing in an inner city hospital. Was once hanging out with the folks when a regular came in. He was into self-harm. This would have been in 2001 or so and I was young, so I had never even heard of this. This guy had spent hours burying a Phillips head screwdriver in his abdomen, carefully working it around major organs. He was a Vietnam medic and had some training, so he could feasibly do it. He straight up said, "What screwdriver? You all are crazy." The attending was staring right at the x-ray and the handle of the screwdriver sticking out of his abdomen. The screwdriver must have been 4 inches long. I still shudder. I once had a patient come in with large calluses on the front of his ankles, which is a very unusual place to get calluses. I brought it up a few times because I thought maybe he was wearing his shoe wear improperly, but he kept waving off the question. Eventually I got him to admit that the calluses are there because he recently started taking a prescription antidepressant medication which made it very difficult for him to achieve orgasm. He found that if he lay on his living room carpet with his legs bent out beneath him in a W fashion and jerked off for several hours he was able to achieve orgasm. Had a patient in hospital, I forget what for. The point is that he disappeared for a few hours. When he came back he was tachycardic to 160 BPM, massive pupils, couldn't sit still. We asked him what he'd taken while he was out. Nothing, he swears. He went to the pub and just drank lemonade. Okay, we say, we're gonna take some blood and find out what you've taken. He then pipes up the friends he was with would think it was funny to spike his drink. What? We asked, did he think they might have spiked his drink with speed? He says. What do you know? Bloods confirmed that he had taken speed, but he insists he didn't take it, his drink was spiked. Ah, the ole speedy be a slipperoo. All my friends play this trick on each. It's hilarious. I'm a nurse. I had a kid once who I needed to get a urine sample from. He was 8. I gave him a cup and pointed him to the bathroom. I went to check on my other patients and came back. Kid was still in the bathroom. I go knock on the door. Hey buddy, you okay in there? Sink on full blast. Yep, everything's fine. I go back to his room a few minutes later and he hands me a bag full of water with a cup inside that also appears to be water. I pour the water out of the bag. Hey buddy, are you sure this is urine in this cup? Yay. My pee is always clear. PT is wheeled off the x-ray. I check the temperature of the so-called urine in the cup. It was ironically the same temperature as the water from the faucet. Come on little homie, you gotta do better than that. That she could actually see. We had this lady that came into the ER at least once per month, usually cheek pain. She was 30s, morbidly obese. She had seen multiple specialists. Had her heart, lungs, GI system examined in almost every conceivable way. One night she comes in with sudden onset blindness. Not her first time with this complaint either. Last time she got a trip to the retina specialist. When I examine her I walk around her bed and she tells her friend to get her feet off the chair so I can get by. She plays it off super cool by adding, if you have your feet up like you always do. Then the neuro exam. I have her touch her nose then touch my finger. Her idea of how a blind person would perform this exam is to touch her nose then wobble her hand from side to side as she touched the end of my finger. Not to mention the near constant eye contact as we talked. I would ask a question and start moving while she talked and she would follow my eye perfectly. She was extremely relieved to find out she had conversion disorder and that her sight would be back soon. Maybe it was factitious disorder. I tend to believe all her chest pains and crazy complaints were real feelings she was having due to a number of her social psych issues. In the ER at midnight it's a lot easier to tell her it is a symptom of dealing with whatever social drama was happening in her life and that her eyes worked fine instead of telling her she was lying to me for some gain. Either way she was sick and needed reassurance. She was genuinely relieved though. On the finger to nose test she touched my finger on the first try, but instead of a straight line she moved her hand back and forth about the 3 inches the whole way there, but directly there. My finger was probably 2 feet in front of her face. One of my favorite patients had conversion disorder. She thought she was paralyzed on her right side. I watched her wipe away a very real tear with her right hand when she was distracted. She really didn't realize she wasn't paralyzed. This one happened just the other day. Had a patient come in looking pretty sick. Labs and vitals said the guy was in sepsis and most likely had a bad infection. The question was where. After some prodding and letting him know the seriousness of his situation, he finally admitted to the source of his infection. He didn't want to say it, so he just pointed between his legs. Looking underneath his underwear revealed a smelly, red, swollen, pus-draining scrotum. Some of it was even black and necrotic. Not a pleasant sight and it looked horribly painful. He went on to explain that he had a painful lump on one of his testicles a few weeks back. He was told it was an infection and given antibiotics. The problem didn't go away and by then he had decided to take matters into his own hands. Literally, he tied a string tight around one testicle and proceeded to cut it out himself. Needless to say it became horribly infected and was going to require surgical intervention. Guy ended up doing okay. I'm a CT tech and I was to scan a woman's abdomen for belly pain. She and her girlfriend were there. I have to have a pregnancy test. I have to have one done. I can't radiate a fetus. I even ask none, so no exceptions. She denies up and down she's pregnant, and then, after the test I did, it said she was. She denied it and demanded a blood test, since she was a lesbian and never has fricked men. Well, the blood test came back positive also, surprise, and the argument that ensued was biblical. She was arguing with her girlfriend and the nurses and the doctor. I never ended up scanning her and they chalked up her pain to her being pregnant. The look on her girlfriend's face when I said it came back positive was one I will never forget. The woman in the room with the patient was her so, and they had been together a long time, and the patient had given her so permission, in writing, to allow her to hear her medical information. Many of you might say you shouldn't have told her in front of her so, and you're partially right in a way, but the patient had given her so that permission, and I did not question it. Had she not, I would have asked her so to leave the room. You can give anyone you deem necessary access, or no access, to your medical information. It's not limited to spouses. My friend rented out a room to 2 lesbians once. After kicking them out, she found about 5 or so negative pregnancy tests hidden under the mattress. We all knew which girl they belonged to. She had a guy over a lot, claiming he was just a friend. I feel bad for the other girl. She was super nice. Had an elderly lady from a nursing home come and super altered. She would wake up briefly to answer questions but then would be out like a light seconds later. Usually in this case we assume it's an infection, stroke, etc. But we still ask about drug use, legal and illicit, since it can cause that kind of thing. Lady denied several times she didn't take anything other than prescribed meds. Finally, as we're about to intubate her, put her on a ventilator, since she was getting worse. We cut off her bra and out pops a little baggie with some white powder and a baby straw. We gave her some Narcan and she gasps herself awake. Even after that still took her a long time before she said, well, maybe I did take some drugs from a friend. Since then I've trusted no one when it comes to denying drug use. Just to clarify, I'm not saying I think everyone is a drug addict. I'm just saying if you come in acting super out of it, you're probably going to get Narcan just to cover all the bases. Also, I'm aware that light seconds are not a measure of time. I used the phrase out like a light followed by the word seconds. Just confusingly worded, I guess. Crap, at least she admitted it after the Narcan. I'd say 90% of the patients I saw revived with Narcan and they are still denied taking opiates. I'm an internal medicine resident. Had a patient with sepsis that was being seen by the urology department. When I first read his clinical history, it stated something along the lines of infected wound in the dong. Patient claims he doesn't know how he got it, so I begin my assessment and ask him about his wound. Indeed, he claimed he didn't know how it happened. I decided that the priority was to stabilize the patient and I made some adjustments to antibiotics and other meds. Well, the guy went downhill. The sepsis became severe even though he was with the strongest antibiotics we had and 2 different vasopressors. His blood pressure was through the floor and eventually he needed intubation and went to the ICU. He managed to survive after a complete pinectomy, and about 2 weeks later I saw him again. Turns out the dude was trying to get his dog to lick his dong, and put on some peanut butter on it. Naturally the dog bit him. He didn't seek medical help for about 10 days before the pain and fever was too much. If we knew from the beginning that the wound was inflicted that way, the antibiotic would have been different. Probably would have made a difference. I still feel sorry for that guy, but with a wound like that he is lucky to be alive. I should have said that a total pinectomy is total removal of the dong. Sorry for all of you that went to Google Images. I'm a nurse, not a doctor, but it's amazing how many patients lie about how much they drink. Dude, we aren't judging you. We just want to know if we need to worry about you detoxing when you come out of open heart, or any other surgery, etc. A lot of comments in here seem to be about your personal doctor visits. My comment was very specifically referring to major surgery. All I am saying is this: if you're going to land in the hospital for a significant amount of time and you're an alcoholic, it is to your benefit and safety to be honest about that, because the odds that you will withdraw in your time there is high. If providers know, they can plan to manage that so you don't withdraw. Last, sounds like a lot of you have run into crappy, judgy people in healthcare. We aren't all like that, and even the judgy ones really don't want you to detox on their shift. Had a patient on our service for a heart failure exacerbation. We weren't sure why she had one now as she had been stable for a few years prior. She also had a documented past use of crack so we checked a urine drug screen. The screen was positive and the next day I rounded on her. She asked me why she had the exacerbation. I told her it was likely due to the her use. She was shocked that I would accuse her of using. I brought up her positive drug test and she insisted it was a false positive and told me she must have picked up the false positive from a toilet seat. That's not how any of this works. Not a doctor but my husband. He had a 17-year-old girl with abdominal pains come into the OR with her mum. Turns out she's in full-blown labor. Assures them she can't be pregnant. She's a virgin. The baby is literally crowning right there in an OR maternity ward in their hospital and she was in advanced labor when she arrived. And she still insists she's a virgin. My husband was the doctor, not the 17-year-old girl. Ha. My mother is a nurse and told me about the time some lady came in for abdominal pains as well. Yep. She was pregnant and gave birth and as soon as the baby was out she screamed it's not mine. Mom responded with it didn't come out of me. Not a doctor, but worked in a hospital for a long time. Had a PT come in that had OD on H. Was able to get him set on that front. However he had necrotizing fasciitis in his pectoral from injecting there. He was septic and honestly a bit of an butthole. He kept trying to tell us the reason he was there was because of a motorcycle accident. We all knew but he was in absolute denial. He eventually heals up and transfers out. After a couple months. He came back about 6 months later to say thank you to all of us and to apologize for all the lies and sholish behavior. Seems it was enough to get him out of that life and onto a new one. I think about him now and then and hope he stayed clean. On my surgery rotation as a med student, warning this is gross as frick, had a patient recovering from having parts of their bowel removed. As part of the recovery their intestines weren't completely connected to let them heal better, so the intestines were connected to a little hole in the skin with a bag attached for the poop to go into, known as a colostomy bag. For reference, this woman was in her late 60s and over 230 pounds. I had to round on her every day, and every single day I'd walk into her laying in bed absolutely covered in toxic gasoline smelling diarrhea. She also had diff, a nasty bacteria that anyone in the hospital can identify by smell, and she would flirt with the residents and make casual conversation while we would clean the crap off of her and fix her ostomy bag. One day we walked up to the room and the chief resident walked in the room, immediately walked back out and closed the door behind him. Looked up to all of us following him and went cheese fingering herself covered in crap. I really wish I was making this up. So yay she never admitted it but obviously she was freaking tearing at all the tape covering her ostomy all night until she broke the seal and could get herself covered in crap again to get attention from the doctors. Answer for some questions here. 1. At what hospitals do doctors have to deal with ostomies? Crappy ones. 2. What happened to the patient? No idea. After having her for around 2 weeks my rotation ended and I was relieved of my duty. 3. I can't think of any more poop puns. 4. I did not witness the fingering but I believe the exact term that was used was fricking flicking her bean. 5. She was not mentally disabled in any way and was completely alert and oriented. She wanted attention from the doctors. One resident in particular was her favorite, and figured out how to get it. 6. Why didn't the nurses deal with it? I have no idea. I was a brand new third year student on my first rotation and just figured that's the way things were. After the first week the attending was even coming to the room to secure the ostomy since it kept coming undone. Don't know where this is coming from that people are saying only nurses deal with ostomies. Well that's it for me folks. Not a doctor but many years ago was working as an assistant to an occupational therapist. We got a call out to help mobilize a woman who had been morbidly obese and was told to lose weight. We learned from the daughter she had gained weight but her mother would refuse to come clean on what she was eating. All the daughter knew was that her mother may have been eating deep fried food due to the vast amounts of cooking oil she found in the pantry. When we arrived, she had gained an extra 6 kilos but insisted she had lost weight. She did not look it. Before we began mobilizing her and check her living room for trip hazards, she also had horrendous knees. We took a look at the pantry. Olive oil, peanut oil, sesame oil, any kind of common cooking oil you can find off a supermarket shelf. She had it, a vast stockpile of oil. We asked what she was frying with the oil. She insisted that she wasn't frying anything and that she was eating healthy since the oils she used were healthy. We had to explain to her that oils are still fatty and will still contribute to weight gain. After a bit of poking around the pantry, I noticed that for the amount of oil she had very little in food that could be traditionally fried. She also had little in other foodstuffs that could explain the obesity. I brought it up with the therapist and the therapist then demanded the truth. We couldn't provide complete healthcare until we knew everything. She admitted that she thought healthy oils would help her lose weight and suppress the appetite, so she had taken to drinking the bottles of oil whenever she got hungry. Needless to say, we disposed of most of the bottle of oil and set her up for a home visit with a dietitian. Not a doctor but work in an ER. One day some pretty young parents brought their toddler in because he was super lethargic and not responding to any stimuli, and the parents said they had no idea why. The staff were pretty concerned for him because those symptoms are a pretty big red flag for small kids. So we start running a bunch of tests including a drug screen which ended up being positive for THC. The doc goes and talks to the parents about it and they finally broke down and admitted that the kid had eaten an entire bottle of their weed gummies while they weren't paying attention a few hours earlier and was just high as crap, lol. Work in an ER. This literally just happened to us this past week. Except the parents never admitted to how the kid got a hold of weed. Like, she's 14 months old. She's not toking that crap herself, bud. Trauma surgery rotation. Surgeons are helicoptered out to the scene where a man is impaled on a tree. They are hoisted up to cut him down in conjunction with firemen. The branch lodged deep in his butt and the surgeons return on helicopter. In the ED, straight to CT for pan scan. It's in there, as in through his glute max, minutes. Pelvic alar and the tip of this branch is lodged somewhere alarmingly close to the bifurcation of the iliac, external and internal. He's hemodynamically stable and talking, saying my ass, I need meds. A doc is like, no crap. Asks him what were you doing in the tree, his answer, I used to trim trees. Okay, but were you doing that today? No, but I used to trim trees. Utox is positive for M but it's time to get that baby out so it's stat or for IND and slap. Ish. I get to scrub in and see what it's all about in the OR. The branch is indeed lodged between the iliac artery and vein. At the bifurcation, neither vessel is damaged. We proceed to remove wood chips and bone chips from the enormous hole we have excavated out of his butt, and no suturing practice for me because it's a wound vac for this man, who used to trim trees. In the following days he is in and out of a med-induced haze. We ask him over and over, yo, but what were you doing in the trees? His reply, I used to trim trees. He came clean about the MUs and other drug use. He started to look better and better as he basically detoxed before our eyes. He eventually left in as good health as one can be with a giant mass of granulation tissue where your butt used to be. Never told us why the frick he was in that tree. That man wanted to frick a tree, and by God he did it. A story that resides at the nexus of oncology and psychiatry. Middle-aged man enterer in sweatpants. Worked as an accountant but currently unemployed. He tells me that a urologist had diagnosed him with inflammation of his epididymis 3 years earlier but he hadn't followed through on the treatment, and that he now wanted to get things taken care of. During the physical exam I see a grapefruit-sized mass in his scrotum. It was not subtle in any way. I call in urology and order a CT scan. I tell the guy that this isn't inflammation. It is a tumor and we need to do more tests to find out what type of tumor. He stops me and tells me he didn't understand what I had said. Could I please repeat it? Then he pulls out a pad of paper and writes down my exact words and sits there staring at the words for a few minutes. I just felt really sorry for the guy. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.